Hello all, let's talk about some of the prometric exam questions. Before administering a dose of furosemide or Lasix to a 2-year-old with congenital heart disease, the nurse should confirm the child's identification by checking the hospital identification band tied to the extremity, either arms or legs. And what is the other option? Verify the doctor's child's room number, verify the identity with the second nurse, asking the parents the child's full name and asking the child to tell his name. So the correct answer is asking the parent the child's full name because this is a 2-year-old. Before sending a client for CT with contrast, what should be the nurse's most important action? Teach about the need for post-procedure hydration, verify that the informed consent is complete, place the citrals of the bed up before transport and check the client's health record for allergies. All of them are correct, but the most important is to check the health record for any allergies. While planning for discharge education for a mother of child with diagnosis of rickets, the nurse knows to include the need for an adequate diet. Which food should the mother choose for her child? Options: potato and squash, orange and tomatoes, egg yolk and fish, milk and yogurt. So the correct answer is egg yolk and fish. That is high protein diet. A woman with inflammatory bowel disease is scheduled to undergo stomach reaction at the right lower quadrant, 5 centimeters below the waistline. The nurse advised the patient on how to avoid potential postoperative intestinal obstruction. Which of the following types of food best recommended postoperatively? Broccoli and fish, meat and cauliflower, yogurt and parsley, corn and seeds. So for preventing the postoperative intestinal obstruction, it should be yogurt and parsley. 13-year-old patient is admitted with diarrhea and vomiting. Physician ordered to administer hypertonic solution. So the nurse should administer under this category. Which one is hypertonic solution? 0.9% saline, lactate LR, 10% dextrose, and 0.45 sodium chloride. So these two are normotonic. This is hypertonic, but this is the one hypertonic. A man was restless and observed to have an increased physical activity after heated argument with another person. After the assessment, the following data was gathered like agitated, diaphoretic, distorted. What is the patient's level of anxiety? Mild, moderate, severe, and panic. So the correct answer is panic. Alpha-fetoprotein test is used to detect which of the defect? The answer is neural tube defects. At a prenatal visit at 36 weeks gestation, a client complains of discomfort with irregularly occurring contractions. The nurse instructs the client to lie down until they stop, walk around until they subside, watch the contraction to see how many times it occurs in 30 minutes, and take aspirin. So the correct answer is walk around until they subside. The nurse assesses the client with an ileostomy for possible development of which of the following acid-base imbalance. So ileostomy, it's metabolic acidosis. Gastric suction can cause metabolic alkalosis. Thank you for watching. See you in the next topic. Subscribe my channel.